Gentlemen, I'll speak plainly in a doctor's voice. Not every STD points to HIV, yet HIV can wear the mask of many STDs, so normal checkups or quick fixes create false confidence. CDC's 2025 update shows over 39,000 U.S. diagnoses in 2023. More than 4 in 5 were men, and the South carried roughly 51% of new cases, with intense clusters across Georgia, Florida, Louisiana, Texas, and major metros like New York and Los Angeles. I'm Dr. Jame, a board-certified urologist with 20 years serving American men. In minutes, I'll teach you how to separate 5 look-alike symptoms and follow a precise 3-step testing timeline that protects your future. Prevention first, treatment second. Please listen carefully. Comment 1 if this hits the mark, 0 if you want a different focus. Your one subscription today can protect someone tomorrow. Help us reach 1,000. For American men aged 18 to 55 who are sexually active now or previously, this guidance is specifically for you. My goal is to clarify HIV-STD differences, avoid false reassurance, and ensure HIV testing even after standard STD treatment completed. Let's begin, gentlemen. Take a breath and listen carefully. You may recognize yourself in a few of the notes below. Stay calm, hear me through, because there is a clear plan to handle these symptoms, and you do not need to panic. Let's clear the confusion. HIV hides behind common infections. That sentence is the fence I want you to lean on while we walk through the facts. Early HIV often mimics routine sexually transmitted infections. It can present like urethritis, herpes, chlamydia, a stubborn flu, or even just stress. Because of that overlap, men dismiss signals that deserve attention. Low-grade fever lingers, rashes appear and fade, small painless mouth ulcers recur, lymph nodes swell along the jaw, armpit or groin, and energy quietly drops. Most routine exams look fine in this stage, so reassurance comes too quickly. The virus can stay quiet while the immune system slowly loses ground. 4 mistakes make the confusion worse, and I see them weekly in clinic. First, stopping STD medication early and skipping an HIV test because symptoms improved. Second, labeling everything as only a flu or a seasonal bug. That shortcut delays the right test during the exact window when HIV is easiest to miss. Third, trusting appearances. A healthy look, good workouts, and normal weight are not diagnostic evidence. Fourth, shame and stigma. Embarrassment makes intelligent men avoid clinics, delay conversations, and ignore gentle warnings from the body. Here is the better frame. Symptoms can point you, but only testing confirms the direction. Appearance evidence. Only testing tells the truth, and the truth lets us act in time. So, we will be precise and practical. You will learn the 5 most commonly confused presentations and how to check them against a structured list. Hold that mindset for the next section. We will use a 60-second checklist to separate likely STDs from patterns that warrant an HIV test now. I will also show when to repeat testing after treatment for another STD. And I will map timing for RNA, antigen, and antibody results so your decisions stay precise. No guessing. If you are still with me, it means you trust this clinical guide and want clarity in less than a minute. Listen closely, then write down what you notice because a few patterns can separate ordinary from early HIV. You can check yourself in 60 seconds. Use this fast comparison to see where you stand. Genital ulcers, typical STD, usually present and painful. Early HIV, uncommon, often painless if present. Example: a tender sore after new exposure points to herpes or syphilis. A painless spot warrants an HIV test if other signs cluster. Low-grade fever, typical STD, 1 to 3 days. Early HIV, more than 7 days or on and off for 2 weeks. Example: a brief fever that resolves with antibiotics suggests a local infection. Fever that lingers after treatment needs HIV retesting. Rash, typical STD, localized to genitals or a small area. Early HIV, widespread, non-itchy with faint pink macules. Example: a groin-only rash with burning fits, contact irritation. A generalized, non-itchy pattern after a new partner is a red flag. Lymph nodes, typical STD. One region, near the affected site. Early HIV, multiple regions, including neck. Example: one tender node near a lesion fits local inflammation. Clusters on both sides suggest systemic immune activation. Fatigue and weight loss, typical STD. Uncommon and mild. Early HIV, frequent, subtle, and progressive over weeks. Example: I'm fine, just tired, plus a looser belt notch without dieting is an early clue men ignore. How to score yourself in 60 seconds. Count how many HIV-leaning features you see today, especially lingering fever, diffuse rash, multi-site nodes, and steady fatigue. If 2 or more are present, schedule an HIV test now, even if a recent STD was treated. Practical notes: finish all STD medications as prescribed, but do not let symptom relief stop you from testing. Retest for HIV at week 3 to 4 with RNA or P24, repeat at week 6 with a 4th-generation assay, and confirm again at 3 months. Comment Teach Cook if this framework helps you, or comment 0 if you need me to be clearer and more specific for your case. I will answer you, and I welcome questions on timing and test choices. Bridge to the next section. Keep your checklist handy, because we are moving into a step-by-step testing and prevention routine that turns uncertainty into confident control. I will not claim genius, gentlemen. My aim is a clear plan that protects your health. Knowledge is power. Testing is protection. Think of this as a focused clinic visit in minutes. With 3 steps plus a prevention toolkit, you can start today. Follow it as written, then personalize with your clinician after results. Step 1. Week 3 to 4 after a potential exposure. Use an HIV RNA or P24 antigen test to detect early viral signals before full antibodies appear. This window is critical because symptoms may fade, routine exams look normal, and yet the virus can still establish itself. A negative at this stage is encouraging, but not final. Keep condoms and avoid blood contact while you await Step 2. Step 2. Week 6 with a 4th-generation combination test that detects P24 antigen and antibodies. This is the main checkpoint and must be scheduled even if an earlier STD was treated, because symptom relief is not HIV clearance. If week 6 is positive, move promptly to confirmatory testing, baseline labs, and a discussion about starting antiretroviral therapy. If week 6 is negative, plan month 3 confirmation, especially if risk continued or partners changed during the window. Step 3. The month 3 confirm visit with a 4th-generation test, plus a full STD panel covering syphilis, gonorrhea, chlamydia, and hepatitis. Discuss vaccines too, including hepatitis A and B, influenza, COVID boosters. Now the protection pack, a compact set of habits for now and later. Use condoms consistently, paired with water-based or silicone lubricants to reduce microtears and friction. Practice dual testing with partners before stopping condoms. Test now, repeat together at week 6, and confirm again at month 3 if risk continues. If either partner tests positive, pivot to care promptly and learn about U equals U, meaning undetectable equals untransmittable with adherence. Retest every 3 to 6 months if you have new or multiple partners, engage in anal intercourse, or had a recent STD, because inflammation raises vulnerability. Put screening on your calendar like dental cleanings. For condoms, choose the right size, check expiration dates, open carefully, pinch the tip, roll down fully, and hold the base during withdrawal. Store away from heat, never reuse and replace after any break or leak, even if exposure seemed brief. For lubrication, avoid oil-based products with latex condoms because oils degrade latex. Use water-based or silicone, and reapply for longer sessions. If sex toys or group settings are involved, clean devices between partners and use separate condoms for each sequence. If ongoing risk exists, discuss pre-exposure prophylaxis with your clinician, including daily oral options and long-acting injections. Understand adherence, side effects, and monitoring schedules so protection remains reliable. If your partner is positive and undetectable, remember U equals U is dependable when treatment is consistent and viral load stays suppressed. That truth supports intimacy while maintaining safety. When any symptom returns after STD treatment, do not explain it away as stress only. Use the checklist, repeat testing, and update your clinician. Pharmacies and community clinics can provide rapid tests when appointments are delayed, and prior results help staff pace the timeline. Write down exposure dates, symptoms, medications, and partner plans on one page, and keep it on your phone. Transparency lowers fear and keeps both of you aligned on the same calendar. Comment Chia C if this roadmap could help someone important in your life. You deserve clear answers. In the next section, I will connect this routine to the science showing how timing and repetition create steady confidence. A minute of science can save you years of worry. Here is the clearest way I teach the biology in clinic. Precision guides smarter, calmer decisions. Clarity reduces fear. After exposure, HIV RNA rises first, usually around day 10, when the virus begins replicating rapidly in blood and lymph tissues. Soon after, the P24 capsid protein becomes detectable between 2 and 4 weeks, signaling active production of viral particles. Antibodies come later, typically between 4 and 8 weeks, as the immune system builds a targeted response. Fourth-generation assays detect P24 plus antibodies, which is why the week 6 checkpoint is such a powerful moment in the timeline. During this early window, symptoms may fade even while replication continues. That is why a single early negative can be falsely reassuring, and why we schedule repeat testing to close the gaps. Now, the link between other STDs and HIV is not theoretical. Inflammatory STDs like herpes and gonorrhea increase HIV acquisition risk roughly 3 to 5 times by creating microtears, recruiting target immune cells, and raising local viral concentration. Healing a visible lesion does not immediately normalize tissue integrity or immune signaling. Even when a sore closes, the mucosa can remain fragile, which is why condoms and lubricants matter while retesting proceeds. Treating an STD, therefore, improves comfort and reduces transmission of that pathogen, but it does not automatically rule out HIV from the same exposure. If testing for HIV was mistimed, you can still be early in the curve despite feeling better. Viral load tracks with transmission risk in a near log linear manner, which means small changes early can matter a great deal for partners. The goal of modern therapy is to suppress viral load until it is undetectable, because undetectable equals untransmittable with consistent adherence. Think of the schedule we built as engineering redundancy into your safety system. RNA or P24 at weeks 3 to 4, a fourth-generation assay at week 6, and a confirm at month 3 protect you against timing errors and symptom noise. Science is also the reason I emphasize dual testing with partners before stopping condoms. You are not judging each other. You are synchronizing biology with trust. Hold this framework as we move forward. Next, I will show you a brief case study where the timeline, the repeat tests, and the prevention toolkit turned confusion into control for a real patient. Precision plus repetition builds confidence. Word count: 400. Mark was 42, a meticulous project manager. 3 STDs in 18 months slipped past deeper questions about HIV testing. Each episode improved with treatment, he felt reassured, returned to routine, and never scheduled an HIV screen afterward. A single early antigen test had been negative after his first exposure, which cemented false confidence and quieted uncomfortable conversations with partners. Fatigue crept in, 10 pounds vanished without dieting, and small bilateral jaw nodes appeared, but he blamed deadlines, travel, and gym overtraining. When a lingering 2-week fever followed an otherwise minor urethritis flare, his primary clinician finally ordered a 4th-generation test and baseline labs. The result was HIV, stage 2, with a moderately depressed CD4 count but no opportunistic infections, and otherwise stable organ function on screening. We moved fast, repeated confirmatory testing, and began contemporary antiretroviral therapy with a regimen selected for adherence, convenience, and minimal interactions. Within 6 months, his viral load became undetectable on 2 consecutive measurements, and his CD4 count rose steadily into a safer range. He learned that STD treatment does not rule out HIV from the same exposure, especially when testing is mistimed during the early window. He also learned that HIV often masquerades as common infections, creating the illusion of recovery while the immune system quietly loses ground. We rebuilt his prevention plan: condoms plus lubricant, dual testing with partners, and calendar reminders for 3- and 6-month retesting intervals. Our debrief ended with one lesson he repeats to friends and colleagues. An STD is a warning signal, not a finish line. Comment "tested" if this story reflects your experience, because your voice could spare another man months of uncertainty and unnecessary risk. In the next section, I will connect his turnaround to practical habits that radiate beyond the clinic and stabilize confidence long-term. When awareness grows, fear fades. You do not have to live in suspense. Knowledge gives shape to decisions, and decisions restore a heartbeat to daily life. Start with belief. Optimism is not denial. It is acting early, following evidence, and building habits that make health predictable for you and the people you love. Here is the practical ripple I watch in clinic. Anxiety drops when men replace guessing with a written plan, partners communicate more openly, and intimacy becomes safer because testing is scheduled, results are shared, and boundaries are respected without judgment. Adopt a monthly C-Sense scan. C. Take 60 seconds to look for skin changes, rashes, ulcers, or swollen nodes along the neck, jaw, armpits, or groin after new exposures or recent illnesses. Sense. Check energy, sleep, temperature trends, and weight, noting fatigue that persists, night sweats, or clothes fitting looser without effort. These quiet signals deserve a mark on your calendar and a short note. Scan. Run the testing timeline you learned. RNA or P24 at weeks 3 to 4 after risk, 4th generation at week 6, and a 3-month confirm, adding a full STD panel when appropriate. Share your plan with your partner. Trust accelerates when 2 adults agree on condoms and lubricant now, dual testing before stopping, and retesting every 3 to 6 months if risk continues or an STD appears. Tie the routine to life you already live. Set the first Saturday of each month for C-Sense scan, pair it with laundry or meal prep, and store home testing reminders next to your vitamins so the cue is effortless and hard to miss. Measure what improves. Less worry, fewer arguments, better sleep, and clearer choices about relationships are clinical outcomes as real as lab numbers, and they grow when the routine is simple and repeated. Protect your circle beyond yourself. Early knowledge lets you warn a friend kindly, guide a younger man to a clinic, or share this checklist with family without stigma, because clarity is a gift, not a verdict. Hold to the truth we proved with science. Undetectable equals untransmittable when treatment is consistent, and prevention remains powerful when condoms, lubricant, and retesting are treated as ordinary maintenance, like changing the oil in a car. Keep your confidence. Next, I will compress the entire playbook into a short conclusion with specific next steps and a final call to action you can follow today, confidently. Here is the truth, gentlemen, and I will be concise like a doctor who respects your time today. HIV can imitate common STDs, which means symptom relief after treatment does not automatically eliminate HIV risk. Routine checks may look normal during early infection, so a single early negative test should never close the book. Remember 3 anchors for your decision-making today. First, HIV can masquerade as sexually transmitted infections, confusing both patients and rushed clinics. Second, periodic testing is the key that unlocks clarity and prevents late diagnoses that cost health and peace. Third, U equals U means undetectable viral load brings control and prevents transmission when treatment is consistent. Carry the protection pack forward without drama or stigma. Use condoms with proper lubricant, practice dual testing before stopping barriers, and retest every 3 to 6 months. Tie reminders to monthly routines, share results transparently with partners, and keep a simple one-page health log on your phone. If symptoms return after an STD, do not rationalize them away. Run the checklist and restart the testing timeline. Share this video with at least one friend who needs clarity more than comfort today. Comment, faith. If you believe knowledge is the best prevention, because truth reduces fear and builds community. Subscribe to receive the checklist and free guidance from Dr. Jame, so your plan stays accurate and current. Your attention can save time, money, and worry, and it can quietly protect families and relationships across your circle. You are not alone, and you do not need perfect behavior to deserve excellent care and outcomes. Take the next step now. Schedule the appropriate test and keep the timeline until the last confirmation lands. That is how confidence returns, how trust grows, and how prevention becomes routine rather than stressful exceptions together.